So I promised that I would quickly do a video on how I approach the diastasis recti. I think what's really important is we need to understand that the more we activate abdominals in movement, like flexion, stretching the abdominals into extension, doing big range lateral flexion, we are actually increasing the tone or the activation of those muscles. And those muscles, when they're split in the center, the more toned they get, the more they tend to pull away. So we're trying to set the transverse abdominis first and foremost back to its former glory. So I only end up doing chest lifts or any kind of movement abdominal work or extension much later on. For example, I'm talking like 5 to 6 months after they've had a baby, maybe even longer. Only when I see that the abdominal contraction is really coming together and it's pure and it's solid. So that's really important. So I actually start them with breathing. And what I encourage them to do is, first and foremost, I explain to them why our approach is going to be completely different for them. So if they were training intensely with me before, I can now say to them, listen, I'll train your legs, I'll train your arms, I'll train everything, but this I'm going to take care of, because the last thing you want is for that to increase. So I want to get it to decrease. So all I'm going to ask you to do is trust me. It's going to take us a couple of months, but if we do this right, you'll be grateful in the end. So I have them in that neutral pelvis. I want that neutral pelvis because I want them to get an activation in their back as well, because we know that there's that gentle activation when we exhale that also comes from the back. So I'll just show you with my arms up. I encourage the lateral breathing because I don't want them to be doing that, because we're trying to get this to happen, all right? So from there, in through the nose, open the back of the throat. And then I ask them to exhale, just activate pelvic floor. So they don't have to think of anything else, because in actual fact, transverse abdominals will automatically start kicking in if you're doing a good pelvic floor contraction. Then my question is, did you feel the pelvic floor? Can you actually feel it activating? I need you to feel the full from front to back pulling up inside that pelvis. No shift in the pelvis is allowed to happen, because then we know that they're doing a glute squeeze for a pelvic floor contraction, right? So from there, deep inhale. Just pelvic floor. And we do quite a few of those. Then I add in transverse, and I say to them, right, as you exhale, I need you to blow all your air out of your lungs, because I don't want these ribs to stay exposed. And we know that the transverse abdominis brings it in really nicely. So, as they exhale, I ask them to exhale, pelvic floor pulls up, and then to activate the tummy, but to think of drawing it down, and then feel like they actually want to compress and narrow their waist. So they get that wraparound feeling from pubic bone all the way to the ribs. In the beginning, if their stomach is out here, you'll see it'll be a small movement, but as long as I see something's pulling down, it's going to be really slight. So we're talking about, we want to see progress in like 5 to 6 to 7 months if we really want this to work well. Okay, but this is step 1. So we're getting them to do pelvic floor. We're getting them to exhale all the air out, but keeping the extension, not doing that. Getting the feeling of flattening down and narrowing the waist. And you can have them rub their hand over to feel that it's not forming that ridge. So that's the first thing. Then I say I need you to bring your feet closer to each other, because this is setting them up for failure, for that stability, because now I want to start activating this to give them a little bit of resistance. So from there, same thing applies. Our exercises that we know. And I say, I want you to feel like that there's tension on this left-hand side. Rub your hand across, it's flat. That tension on that side is going to keep this pelvis still as we raise this leg up to 90 degrees. So we just do our normal single leg lifts, but because they're doing this lateral breathing, I want that 20 to 30 to 40% control and activation happening here. Once I get them doing the single leg lifts, and I obviously alternate to the other side, I then say, right, that pressure that you have there and that activation, I want the same amount, maybe a little bit more, because now I want to challenge your abdominals to keep that activation as I make any limb heavier for your body. And this is how I'm going to get your abdominals to recover back to where they were without loading them too much right from the beginning. So then we go over to these, which we know, all right? And then when I see, okay, so session 6, she's actually doing really well. This feels a lot better. Obviously, the only homework I give them is that during the day, I want them to just try and get that gentle activation, pelvic floor up, abdominals draw down in towards each other, and they must feel the back pressing up against the tummy. So that's the core contraction. Now we know all the research that's done on the core, and we're not going to get into that now. But what we are going to get into is once you've had a baby and your stomach has been out here, you want that transverse to go back. So that's why it is super important for these ladies. All right, so we've got them there, and she's doing really well. The next progression would be to take the leg out, because you see all of this is held and it's stable. And if she's not sure, because there's a little bit of extra adipose tissue or extra tummy because of baby, it's all going to go back. That's the great part, is you can ask her to just put her hands there and feel that it's firm without that ridge. And you dig in quite deep when there's extra. Then exhale, lower it down. Here the emphasis is you're going to say to her, your abdominals are attached onto your pelvis there and on your pubic bone. They're going to keep your pelvis from doing that. So this is how I'm strengthening you without lifting your chest up to get this all to come back. So it's just exhale down, inhale up, exhale down, inhale up. So just a few of those, and then bring it back in and place it down. Right, so we've established that. We said, great, you're doing fantastically with one leg. Now I want to challenge it a little bit more. So I'll show you a few things that we do. This one, you know, where they're there. If you're not sure whether she's going to cope with this, I'll show you what we'll do. You're going to exhale, arms by her sides if she needs a little bit of support, otherwise there. Say to her, the abdominals again are on that pubic bone. They're going to control your pelvis as you switch your legs over. But again, I want you to think of not letting that go. So let's do a lateral breath. Pelvic floor. Abdominals draw deep, waist narrows, and then only are you allowed to switch those legs over. Inhale laterally. Exhale pelvic floor. Abdominals deep, waist narrows, and then we switch the legs over. So that's one of those that I absolutely love doing with them. When I see that, oh my goodness, she's actually getting quite good at this, I'm going to bring both legs up, but she still stays down. I like to ask them to push their head down into the mat a little bit, because that does take a little bit of pressure away here and puts more into the upper back. Then you will do this one, which is single leg. Reach it out, bring it in, reach it out, bring it in, and place it down. So those ones are nice as you start progressing. Then, let me quickly grab this, my foam roller. So I love to take the foam roller, put it right underneath the pelvis, over there. All right, holding on the side, lifting the legs up. So here I want those two legs at 90 degrees. Not too close to it because I want to get this to activate, but also not too far. Holding on the side there, and this is really low on the pelvis. From there, exhale, gently lower it down. And this is a little bit friendlier than when you're just lying with your hips on the mat and lowering the legs down and switching them mid-air. So it just gives you that little bit of elevation, which takes that flat pressure away from your abdomen. So this is really nice to get them to activate. It's much easier for them. And you're going to say to them, as this leg goes down, you feel like that pubic bone wants to pull to you a millimeter, and then bring it up. And then gently down and controlling it up, being aware of what's happening here. But there's no chest lifts yet. Then you can alternate legs mid-air, which I also love doing. And then you can do extension out, maintaining that. So this stays, even gently pressing her head in if she needs to. And then as she gets stronger, we'll be taking it lower and lower and bringing it down, releasing it there. So that's also lovely. Because you've elevated the pelvis, there's a bit more pressure this way and there's less focus on this area than when you're lying over here and you've got to maintain everything. So that elevation makes it a touch easier. So that's really lovely. Right. Then, obviously, everybody's going to know this, and you've all mentioned it, but how we do it is super important. So we want them lying on their hands and knees like this, the 4-point kneeling. All right? Obviously, getting them to press away, not drop there, just find that comfortable position. Allow them to let the stomach hang down, so you want that to actually let go. All right? You're going to say to her from there, inhale, exhale, gently pull the abdominals away from the mat, closing the rib cage because you've blown all the air out, and then release it. And you can allow them to completely release it so that they can feel the difference. Exhale, pulling it up. Pelvic floor pulls up as well. Abdominals pull away from the mat, and then gently release it. So it's that. When I see that they're coping, I actually curl the toes under, keep the spine as it is, and then say exhale, draw it in, hover the knees just off the mat. Because now I'm giving them a little bit of extra load, and gently lower it down. And exhale, pulling it up, hold, and controlling it down. And exhale, pulling it up, hold, and lowering it down. Right, then lying flat on the mat. And why I love this is because they've got a solid surface, so they have a reference point to be able to pull their abdominals away from. And it's much easier than having them pull their abdominals away from air. Okay, so they've got something that is actually resting against. So over here, they're going to inhale, elbows not close to them, always away, so that they can rest their chest down, legs relaxed and even open. I don't want hip flexors bothering them, size of thighs bothering them, none of that. Everything's out of the way, okay? And after you've just had a baby, there's a little bit of extra that's in the way. It's going to go, but it's there. So we're relaxing down. You're going to inhale. As they exhale, they've got to get the feeling of contracting the abdominals away from the bed without squeezing the bum. So that's important. And then release it. And you can encourage them to blow all the air out to get the ribs in as well. Just drawing it in, pulling it away. So what are we trying to do? We're just trying to wake it up again. It was sleeping and stretching. So we really wanted to just recover again. And this is low load stuff, just trying to get it to pull back to where it was by waking it up and saying, can you remember what it felt like when you contracted? This is what I want you to do. So you can even use this as one of your first exercises to help her to just get that feeling of what it feels like when you're actually drawing your abdominals back towards your spine and then narrowing your waist, okay? So it would just be an inhale. I'll turn my head this way, but I've normally got them this way. Right, so it would be an inhale there. And just pulling it away from the mat to the best of their ability. And inhale, release. So that's fantastic, right? Then, from there, now you can start looking at things like, if you see that they're coping, and it's really getting stronger, and it's pulling in, and the waist is narrowing, now you can add things in like, 1, and then lift and lower, lift and lower, just that, lift and lower, using the deep inhale, using the exhale, draw it in, lift it for a moment and lower it, switching over to the other side, just that brief lift and lower. And eventually when she gets there and everything's working well, and this for us I think was 7 months, 6 or 7 months, I'll have to go and check. They cope beautifully with this. If you've gone through that process and you've been patient, super important, being patient. Then when I see, okay, it's actually all working out quite well, now I say to her, right, let's try a chest lift. And lower. So now I say to her, all you have to be aware of is when you come up, I don't want that big reach in the middle. Everything that we've worked on, where we've been flattening, I need that to flatten now as you come up. And then gently lower down. Another one that I love doing with them, taking the foam roller. There we go. That's it. All right, resting the hands over the tummy. I do allow them to have their feet a little bit wider because I'm not here to only focus on their balance. I actually just want to get all of this back in. And we know that if I lift this leg, this side's abdominals and obliques are really going to help me. So inhale, exhale, holding on to that side, lifting this leg up to 90 degrees. Hands rest here, and then slowly controlling it down. This down part is important. So you say, now here you've really got to concentrate because you're going to want to arch your back. And this is attached onto here and it's going to stop that. So inhale. Bringing it up. Just maintaining that. The elbows are relaxing down. Hold. And then you can reach it away, increasing that. Concentration, balance, everything. You can have the arm up and reach it away and bring it in and placing it down. But the whole point is that we take them right from the basics, right from the beginning, get them to practice that gentle pelvic floor transverse, back pressing up against the tummy, waist narrowing. When they're standing in the kitchen or they're at work, you've got to say to them, you know, in order for anything to recover, we have to remind it of where it was, which means that you are continuously, throughout the day, going to activate, draw in, pull up, release. Activate, pull up, draw in, release. Because you can't expect it to go back to where it was for the 2 or 3 times you see me a week. You have to make this a consistent thing where you're always thinking about it. For me personally, when I had my first and my second one, straight after my 2 girls, I put on one of those really tight bands because I was like, you're going back. Because when I saw what it looked like straight after, I was like, is this ever going to look the same again? It's like jelly. What on earth am I left with? But I'm happy to say it went back. So I used to put on that really tight band that was kind of uncomfortable, but it reminded me that I had to pull in. So I made it tight enough so that I felt like I wanted to pull away from it a little bit. So that was just me. I really wanted it to go back. I was like, I really don't want this to stay like this. And then afterwards, I forced myself to wear clothes that would make me want to hold it in. So I didn't wear big baggy t-shirts and things like that. I didn't wear tight things, but I made it a top that if I had to let my stomach go like I wanted to, it would make me feel uncomfortable. And if I caught a glimpse of myself, I'd be like, that doesn't look very nice. So I actually wore clothing that would force me to be conscious of having to draw this back and get that tone back. Long video, I hope that helps. Cheers.